Welcome, viewers and listeners, to the Health Revolution, the program that shows you how to have a life of vibrant well-being. In a world full of noisy health trends, we bring you clarity. In a sea of fads, we reveal the science-backed strategies that truly work. We explore physical strength, emotional resilience, and mental mastery. These are the keys to an enriched life. Join us for inspiring interviews with champions who conquered life's health challenges, fueling your journey. Are you ready to unlock your potential? To live with vitality and purpose? Then join the Health Revolution. I'm your host, Adriana Morrison, health and fitness expert, speaker, and a mom who understands. Let's embark on this transformative quest. Together, we're about to change the game, starting now.
The information provided in this show is intended for educational and entertainment purposes only. Viewers should use their own discretion and consult with a healthcare professional for personalized guidance and recommendations. Hello, everybody, and Happy New Year. Welcome to the Health Revolution. I'm your host, Adriana Morrison, and I'm so delighted to be with you today to kickstart 2024. Is the time to look onward and upward and really elevate our lives in all ways possible. And as you're tuning into us, just know that we have important information in our show notes at the bottom of your screen. So take note because you're going to want to have that reference information. So as we're turning a new year and as we're looking to better our health and increase that emotional resilience and that mental health piece as well, we are excited to bring you a season where we're having the right conversations to get the ball rolling. And with that, it was extremely relevant to dive into our topic today, that cardiovascular piece meeting that holistic health process. And my guest today is someone who is very well, she's expertise in this field. So take a look at this video. Let's get to know her. Watch this. Dr. Prarthana Shah is a renowned figure in the field of preventative cardiovascular medicine. Her expertise extends beyond traditional practices, as she's also a certified integrative health coach trained by both Duke University and the Institute for Integrative Nutrition. With a deep commitment to reducing cardiovascular disease risks, Dr. Prarthana embraces a holistic approach. She works globally, coaching individuals to implement sustainable lifestyle changes, leading them towards happier, healthier, and disease-free lives. At the heart of her work is Buova Care, her coaching practice. This is where her worlds collide for the greater good: cardiovascular care and holistic health coaching. This allows her to be a greater asset to her patients. Now, her professional journey is one where she seeks to share her message everywhere, that this combo approach to healthcare brings greater value to those who seek better health. Dr. Prarthana Shah, welcome to the show. How are you?
I'm good. It's great to be here, and I'm so excited for today.
Oh, me too. Happy New Year, first and foremost. And I want to dive right into it. Cardiovascular health. You know, we understand that it is an area that we have to focus on. Tell me, what are some of the things that you're noticing that we really need to take in as we're starting the new year? What are some trends that are important to society? And let's start from there.
Okay, so firstly, Happy New Year, everyone. It's great to be here. Now let's talk about some trends that, I've been noticing in actually the world over, not even just India, not even in the US. Number one is exercise. I feel like it is picking up. There is definitely a positive trend towards that. And because, of course, lack of physical activity is one of the most important risk factors for cardiovascular heart disease. And there is, of course, an uptick, but I feel that there needs to be so much more when it comes to physical activity. So I feel like this is something we should be looking at, especially as the year begins. I also think that we need to be looking at smoking cessation. I know that there is a lot of awareness around this, but I still think that we need to be looking more in depth, especially with youngsters, because smoking is honestly the biggest risk factor for cardiovascular heart disease besides lung cancers and other things. So I feel like this is another very important thing that we should be looking at creating more awareness about and also looking at cutting back on.
So, what was it about the cardiovascular realm, the landscape, in terms of this being an area of concern for health? What really drew you to being this, diving into this and having this be an area that you wanted to become an expert in?
So I feel like it's been a journey. I'll always liked cardiovascular, the system as I was studying medicine and things like that. So that was something that was close to me. And I also got into fitness while I was in medical sort of school because I found that as a way to cope in a way, mentally, physically. It was a way I sort of, at the end of a tiring day, you just go and work out and you feel so much better afterwards. And so I grew very passionate about my fitness. And again, that affects your cardiovascular health. So I feel like I just sort of grew into this profession, really.
So I will let our viewers know that you are in India. So we've got a little bit of a time difference between here and there. What are you noticing the comparing and contrasting of trends? How is it? What do you notice in India in society's trends versus here in the United States? Are there similarities with how we're approaching health these days, or are there some concerns that you've noticed that have popped up on the radar?
So, firstly, with food, I feel like with India, at least, there is less processed foods. It is coming, of course, it's there in all the supermarkets and everything, but there is less canned beans, there is less, processed meats and things like that, at least in our regular and daily diets, which is a positive trend. I feel like the West needs to work a little bit better on that. But with physical activity, again, I think that India does lag behind as compared to the West. There is now a community that is very strong, and the younger and the more aware, the more well-traveled communities are very passionate about their fitness. So there is that, but there is a disparity here because I feel like there is a different level of education, different social strata. So I feel like there needs to be a more generalized awareness about that.
How about with women? What do you notice in the trends for women? What stands out for you? Has there been an uptick has there been a noticeable uptick with women taking better care of themselves over there versus here? Or has it just been slow and gradual and maybe the speed is not as quickly as preferred?
Yeah, so there is definitely an uptick. I feel like my generation is at least a lot more aware. I feel like my parents' generation, even our grandparents' generation, may be a bit, lagging behind with that. But there is definitely a change coming, and it is coming fast. Not fast enough, in my opinion, but it is coming for sure.
What was your personal breakthrough as you decided to embark on this profession? What was the one thing that you noticed as a woman from India and studying? Obviously, your studies led you to different areas. What were some things that that were part of your journey that allowed you to have a bigger voice and utilize the right tools to help others?
So I feel like I come from a family that is all doctors. So I feel like with that, I was always very empowered to looking after people's health. And it was something I was always passionate about because I saw it happening all around me. My parents are doctors, my grandparents are doctors. So it's what I've seen. The service is what we've always been doing as a family, at least. And yeah, so that was one thing. I also really enjoy working with people on their health. And when I look at cardiovascular health, a lot of that is really preventable. And what was my breakthrough essentially was coaching, actually. So I've been aware of corporate leadership style coaching with my mom has been reading all these self-help books all her life, and she has also a leadership coach, besides being a doctor, of course. And that is, so I was aware of those things. And then I felt that coaching would be really beneficial in a healthcare perspective, because a lot of lifestyle, a lot of preventive healthcare and preventive heart disease is based on lifestyle. It's based on what you eat. It's based on your activities, your exercise, all of that. And as a doctor, you don't really give enough time to it. When you look at a patient, you advise them for about 5 minutes and that's it. And then you have the next patient and the next, and you don't get to talk to them in depth about their life. And you don't really know if they're making those necessary changes. So I really feel like for me, coaching was the breakthrough where I can talk to them about these sort of changes that they need to make, and actually work with them, hold their hand, and see that they make those changes and actually see their health improve.
You highlighted something that has been a growing awareness of, and it's the disconnect between the ability for patients to have a better conversation with doctors. Do you think, how far does this go back where it was first recognized? When you were going through all of your schooling and all of your training, was this something that was talked about, or is it something that you started to notice that was an issue as you were coming through all of your training?
So it is definitely something that I noticed, especially in medical college, because you'll have a OPD of about 50 patients outside, and you really don't have the time to spend with all of them. And they're all, serious or not, but they all need the care and attention, definitely. And as I shadowed doctors, there are a few doctors, I would like to say, that definitely spend more time with their patients and schedule less patients. But then that comes at a cost also, because people do need the attention and care. So it's a give and take, honestly, because you want to be able to help so many, but you're not giving enough time to most people.
Do you think doctors have the voice to share their concerns, or are there pressures that make it harder to do so? And by pressures, I mean, are there other elements that help run a clinic, a practice, that just make it hard to put a whole lot of attention on these concerns?
Yeah, so I definitely think that, see, with private practice, I don't think that is such a problem or a pressure. But yeah, in a corporate setting or in a corporate hospital, or if you're on a full-time, job, then yes, definitely. I feel like a lot of those elements come into play, and you can't be doing the work you really want to be doing.
So the expectation that you mentioned, your family, you come from a line of doctors, which sounds extremely prestigious. And was that ingrained from the very beginning, that this was the line of profession that you were going to get your footing from? Was that something you just understood you were going to be, or did you feel like I have a natural calling to go?
No, so I definitely felt like I had a natural calling for it. My dad, in fact, did not want me to be a doctor. He was dead against it, actually, because he wanted me to do something more creative or something slightly different, because I am a very creative person as well. So, because he knows it's a hard profession, it is not an easy life, definitely. And so, but I was always very passionate about it. And I saw people, and I saw my own parents helping so many people and being able to, help them lead better lives. And that is something I always wanted to do.
So the transition between, being a doctor and then adding on to the different levels of expertise that you now represent. What was the turning point for you where you knew that this was something you absolutely had to do? Which, by the way, this is not very common to have doctors have several hats. Like for one, many doctors just that's all that they're able to do, and so it's hard to wear a bunch of hats, I would imagine. What was the turning point for you that you knew that you had to do more?
So the turning point really was once I started my practice in preventive cardiology. I noticed that a lot of the time that I'm talking to the patients, I'll advise them about their diet and exercise. But again, like I said, I'm not giving them enough time, and I'm not actually seeing the results. And I was aware of coaching, and I also read these kind of books, and I felt like this would be hugely helpful uh, to actually work on these preventive aspects. Being a very passionate exercise enthusiast myself, I know how important it is, and I know how particular I am about my workouts. And I sometimes, as a doctor, when I didn't have the coaching mindset, while I was talking to patients, I didn't always understand why they just wouldn't do it, and once I developed the coaching mindset and sort of learned that aspect, I feel like I can help them so much more because I'm giving them the whole package, really, because I can actually be talking to them about their lifestyle in depth and actually seeing them make the changes and do what they need to do to actually change those health parameters around.
So let's be honest, in medical school and just as you're going through your studies, because I'm only imagining what all that you had to go through to be this expert. How much of the training is behind in where we need to be as a society? Did you find that that any portion of your training covered the preventative care, or is that something that just continues to run? And I see you're already starting to shake your head.
Yeah, so definitely, I don't think that allopathic and most modern medicine systems all over the world actually don't really approach healthcare as healthcare. It's more sick care than healthcare. You're looking after those who are sick. You're not actually reaching the root causes of the illnesses. You're not trying to prevent these things from happening in the first place. As in medical school, we didn't actually learn nutrition. So it's funny because doctors don't have lectures on nutrition. So they don't teach you that. And what you eat is so important for everything in your body, for your whole entire health. So it appalls me actually, but they don't teach you any of this.
So, and this is ever apparent that, no shade being thrown to the medical profession. It's just that it's, as of the landscape, it's not something that's part of what's already protocol. What are you noticing about colleagues and what they're saying about that? Have you take notice as to how others in this space, other doctors are talking? Is it something that is coming up more in discussion?
It is. I feel like preventive care is the next big thing. It's not a big, postgraduate course here in the country. I know that there are a few in the US and there are a couple in the UK now, but it is very new and emerging. I feel like all my colleagues, everybody actually knows that this is the way to go, but it's just that because the systems aren't in place and most modern healthcare systems don't teach this, at least at an undergraduate level. I feel like there is a lack of knowledge around this, and there really needs to be more focus on this now.
Do you think that there is pressure coming from, say, insurance, or oftentimes people refer to big pharma, that there's the limited capability of being able to explore these areas based on criteria, or being able to just how the data is how the data results in findings? Do you find that there's pressures in those direction, that doctors just don't have the bandwidth to explore more and to do more for their patients?
Yeah, I definitely feel that the big pharma is a huge, roadblock to this, of course. I also feel like because of government fundings and things like that, there is a lack of knowledge. There is not enough funding towards research. There is not enough funding towards knowing more and actually studying these things in depth. And it is what we know, it is what it is. And nobody really wants to dive deeper into what this really is and why we need to focus more on it.
And I think you're touching on some very important topics. And do you find that as you're approaching patients and those who are really wanting to do better for themselves, are they open to doing more on their behalf, or do you feel like there's still that pressure of like, hey, Dr. Prarthana, fix me. I'm going through some changes, or I'm hurting in this regard and I need some help?
So I feel like this is, it's very individual. I feel like there are some people who are really now aware and they want to do things and make things right. And I feel like maybe they haven't met the right people earlier. And so there are a few, but again, it is very individual. There are some patients that I have seen that I mean, you do the discovery session with them, and they didn't know what coaching was, because at least in India, well, coaching is more in the corporate settings and in CEOs and that kind of thing, but health coaching isn't very big here. It's coming, but there is a lack of awareness. So he didn't know that he has to bring the goals and things like that when it comes to a coaching environment. And he was like, no, but just tell me what to do. And I was like, no, but what is your concern? So there was a sort of, we were not at loggerheads, but well, we were not on the same page, not even in the same book, really. So I feel like there needs to be more awareness. And of course, it is very individual with how much somebody wants to do or not.
That's true. And obviously this is an innovative path. And we're going to dive more into this first. We're going to take a commercial break. We will be right back after this. Don't go anywhere. We will be right back after this.
Welcome to E360 TV, the live streaming and on-demand destination for influential voices and enlightened audiences. We offer trending, grassroots, and purpose-driven content across a diverse range of interests. E360 TV is more than just watching programs. We offer the ability to interact with live shows connecting audiences to real, authentic influencers and storytellers while streaming to millions of devices. Real experiences. Raw conversations. One destination for it all. E360 TV.
Welcome back to the Health Revolution. Welcome back, everyone. I'm your host, Adriana Morrison. We're kicking off the new year with Dr. Prarthana Shah, founder of Buova, cardiovascular specialist. And let's pick up where we last left off. So you were talking about the recognition that it is a partnership between, say, what you're doing in the medical field and helping patients be able to be proactive and be their own advocate. So talk me through the transition of where you are with Buova. Tell us a little bit about that and some of the humble beginnings of your practice.
Okay, so where I am with Buova is essentially the coaching aspect is new. I've been, as a doctor, I've been treating patients in preventive cardiovascular disease, reducing the cardiovascular risk markers, reducing their risk for heart disease and things like that. The coaching is fairly new. Which is what Buova essentially is. It is my health coaching brand. And with this, I can actually coach people globally, which as a doctor, your certifications are based on your country, but my coaching certifications are international. And so with this, I can actually help so many more people all over the world actually create the necessary lifestyle changes or work on their health concerns and health goals. I've been coaching quite a few people online through, different doctors, through patient to patient, and, how people tell one another and things like that. And it's been really interesting to see so many different people and see their different little lives and work with them quite deeply to help them get better.
So question, where does the term Buova Care come from? What's the meaning behind that? I'm curious.
So Buova is something I coined with the girl who was helping me with my sort of branding and things like that. It is derived from the words buoyancy and viva. Buoyancy meaning living a buoyant kind of life, and viva meaning, of course, life in Italian and so many different languages. So it basically means living an energetic and buoyant and very full kind of life.
So as with your coaching practice, what are some things what are some of the biggest concerns with cardiovascular health? What are the one things that is a red flag for you that you've seen with either diagnosis that patients have had or trends that we need to be aware of?
So the one thing is, like I was saying earlier, the biggest risk factor really is smoking. And I feel like this is still very prevalent in many parts of the world, India included. So this is something I feel that it is a habit. It is very difficult to kick off when somebody is, used to smoking every day. But this is the largest risk factor. And honestly, there is so much information now and so much research. And, smoking cessation causes, within 5 years, there is a 39% decrease in the risk of heart disease just by stopping smoking, nothing else changing. And so this is a huge number, and we really need to address that.
What's your favorite way to approach it? What are some areas that you guide patients to take a look at when it comes to understanding their risk factors and just being in that experience of, okay, I can recognize that this is not serving me? What are some areas that what are some of your favorite ways that you like to guide those that you're working with?
So some of my favorite ways, so my approach is essentially a very holistic approach. We look at all different aspects. We look at sleep, exercise, we look at food, we look at any habits like smoking, alcohol, we look at emotional relationships with your family, your financial health, any stresses that you may have. And I ask them a set of questions about where they are in their life currently in all these different aspects, and then where they would like to be on a scale of 1 to 10. And from there, we can really find the areas that each individual needs to focus on. And this is kind of my favorite way of them to sort of getting them create a health vision, create a very creative and a very mindful picture of their best health. And I get them to visualize this or use different methods. Sometimes people like to journal about it, sometimes they like to talk about it. And they create a sort of health vision of their best health. And looking at these concerns from 1 to 10, we then find the action plans that we need to work on, the goals that we need to set, and the different aspects we need to work on.
Do you find that there is a trend amongst different age groups, or what are you noticing that a common response is for different age groups to take a look at their health and take note and take action with how they can better themselves?
So when I look at 40 to 50s, I definitely feel that there is a certain wake-up call that a lot of people have regarding their health, especially if they haven't been very active or healthy their entire lives. Sometimes, they'll suddenly get diagnosed with diabetes or hypertension. So I feel like a lot of them, or at least a large population, has a wake-up call. The younger population, I have actually noticed that a lot of them are already very aware. There are, of course, pockets, but in generalizing it, I feel like a larger number is more aware of their health and they want to work on it. So I actually coach a lot of younger people because they actually want to better their health and not reach that point of illness in the first place.
So I can't help but ask this question as we get older and women are entering perimenopause and menopause. The body is changing in so many different ways. I affectionately call it plot twist because of the different hormonal imbalances. What are some things that come up for you with women entering menopause that maybe women don't realize about their overall health, about their cardiovascular situation?
So, with the cardiovascular situation, before a woman has reached menopause, there is a cardioprotective effect because of estrogen. And so, there is a decline in estrogen, of course, once you hit menopause, and this cardioprotective effect is reduced. So, there is an increased risk of cardiovascular disease as one ages. So, that is a concern that they need to look at or really focus on and work more towards reducing their risk factors, looking at their weight, looking at hypertension. If they have it, get it treated, check for diabetes, check for insulin resistance, check their thyroid levels, so many different things. Sometimes they have endometriosis for women, especially if they've had early menopause. This is another concern. If they've had preeclampsia or eclampsia, if they were pregnant, when they were pregnant with their children, this again increases their risk factor for heart disease.
And I never knew that before. Not that I experienced it because I'm a mom, so there is a connection between preeclampsia and some certain cardiovascular diseases later on, or
Yeah,
is there a
yeah.
link between the two?
Yeah, there is definitely a link between the two. There are a lot of research papers out there actually that you can look at later on. And there is definitely a connection, and there is an increased risk when one has had preeclampsia.
Wow. Okay. I never knew that. Not that it was something that would naturally come in front, that came along my journey as a mom. And where do you want to see, where do you envision the landscape being with the health coaching and medicine? So you're already on the path of combining the two. What's your vision?
So my vision really is to have a more holistic approach. I'd like to have, clients that come to me, or patients that come to me. I don't know what to call them again, because in coaching you call them clients, and as doctors you call them patients. But when people come to you, you really want to be focusing on the whole approach. So I want to see a lot more action being taken, one, by the patients, of course, and I want there to be more focus on an overall health. Look at all these different aspects because they're also interconnected. I call it the wheel of health, really, because each factor is connected to the other. And so I really want there to be a shift from just medicating them and telling them to exercise to actually sitting down with them and creating those plans, putting the necessary work in place, and actually seeing the results now.
How long does it take? How well, this, as I'm asking this, I'm recognizing that this is going to vary, but do you notice a pattern of when you work with someone and you're bridging the gap between the medicinal approach that is helpful based on what's going on and the health coaching? Is there a time frame that you notice for people that you've worked with, for people to notice some permanent changes, some long lasting changes? Are there different benchmarks that come along the way when you're giving all of this attention to these two areas?
So I feel like 3 months is an average, well, ballpark, because habit change and creating new habits essentially takes 3 months, because each habit change is a new neural pathway that you're creating in the brain. If you look at neuroplasticity and that, you actually create new habits by regularly working and doing the same activity repeatedly, and you create those neural pathways. And once those pathways are created, that is when lasting change happens. And then it's not really something they need to be focusing on doing every day, but rather it becomes something that they naturally sort of do, like you would cycle or walk or anything like that.
So being in India and obviously having experience in the Western world, why is it hard, or why is it more challenging for the clinicians environment in the Western side of the planet to embrace holistic approaches? Because I do know that it's not, although the conversations are emerging, they're maybe not as frequent, at least not now anyway. Why the difference? What have you seen in terms of the difference?
So there is a challenge here to talk about holistic care as well. I'd like to say even doctors here don't want to approach a more holistic approach. It's usually allopathic, medicating somebody and then getting on with it. That's how we've all been trained. But I feel like one thing is a roadblock is in the mind. I feel like doctors have a little bit of an ego attached to them being a doctor and actually studying so hard and spending all those years working on actually saving people's lives. It comes with a little bit of an ego boost, which is not good. I've noticed it in a lot of middle-aged men and women out there, and they don't want to see somebody younger and doing something different. They feel like a lot of this comes with experience, which it does, and there is a lot of respect for that. But that doesn't mean that there is no place for a new mindset and somebody wanting to do things a little differently and shaking it up a little bit.
So how do you start those conversations with colleagues because this fascinates me. I think that the bridging between the two is so vital and beneficial. So how does society get more of doctors to lead the way and be okay with exploring additional avenues to help the patient, to help the clients who are now seeking all sources to help them be better?
So it is a long process, of course. There is one that there needs to be more awareness among doctors. And so what I do is I always like to talk to them at an individual level. I find that in larger conversations and larger audiences, some of them will get it, but a lot of them will be just like, this is another conversation that's happening or another talk in a large conference or things like that. So I like to really talk to them and engage in one-on-one conversations with them where we talk about this and how coaching can work hand in hand with medicine and actually help the doctor do what they need to do without spending so much time or energy with the patients and then not seeing the desired results. So I like to do it on a one-on-one level. It is longer, definitely. Online is another way, but again, doctors should be open to that. So it is a little bit of a challenge, really.
So as you're spending more time with your clients that are in the health coaching space, or maybe patients slash clients because they're doing both, or how all that looks like, do you find that when you work with those that it's the expectation is that this is going to be a process. We're going to be on this journey. There's no quick fix. There's no, that it is all about story developing. That do you have different benchmark goals when you're working with someone, or is it that you let them know, listen, it just, the path is going to forge its way as we unravel it?
Yeah, so I think the path has to unravel in itself through conversations, through actually talking to them, depending on what their goals are and depending on where they are currently. I feel like that sort of sets a good benchmark because if they are already kind of at an 80%, then 100% is not that far away. But if they're at a 50, that is a journey, definitely, and that will take its time and energy and effort and all of that.
What are some surprising aspects of being an advocate to your own health journey that general society has yet to really embrace wholeheartedly, in your opinion?
Losing weight is not that hard, at least personally. At least personally, well, exercise is not that hard. Losing weight is not that hard. I feel like a lot of people accept the weight that they have and they're not understanding the health concerns around it. Of course, there is body positivity and somebody should be very comfortable in their own skin and all of that. And you don't want to feel a lack of confidence. But there is a health concern regarding obesity when it comes to heart disease, and that can't really be negated. So, and it is not that hard, if you really put your mind to it, find an exercise that you love, something that you love doing. American Heart Association recommends 150 minutes every week of moderate physical activity, 75 minutes of high intensity. And there is so many different, exercise modalities that one could do. Find something that they enjoy and really stick to it. The results come when there is consistency. It's just about the hard work that you need to be doing.
You mentioned something that needs to be said more and more, and I want to highlight it for for a moment, that body positivity is important to think of ourselves, to really embrace who we are in the individuality. But then there is that fine line between body positivity and working to always to be your potential, and then obesity and being real careful not to justify without doing the work that someone who is on their journey to being better, that there's a difference between that and justifying why someone is larger, but it's because of a good bit of decision making that maybe have happened. Would you agree?
I do. I definitely agree. I feel like you should always be very confident in yourself, but also you can't hide behind the fact that there are these health concerns. And if, the weight is coming due to, say, diabetes or, insulin resistance or things like that, awareness is necessary, screening is necessary. You can't be, sitting behind the screen of body positivity and not actually checking up on your own self and checking whether you have any of these conditions.
Absolutely. We're going to take a break. We will be right back. Don't go anywhere. We will be right back after this. Thank you so much for watching The Health Revolution. Our show is growing, and it's all thanks to viewers like you. No matter how you found us, please hit the subscribe button so we can stay connected and continue to deliver amazing content to you.
Life is so fragile, and we're constantly reminded just how fragile life can be, especially when we or a loved one is told we have cancer. Cancer survivor myself, I can tell you, we still feel very alone in this journey.
There's a study that's been shown that patients who are socially isolated have a worse prognosis, have a worse outcome than patients who are socially interconnected.
Buddies for Life is a non-profit cancer support group for those whose life has been impacted by cancer. Humor, hope, heart, and hugs.
Humor, hope, heart, hugs, and a whole lot of love.
Share this with your friends and family and support this community in every way you can. No one should face cancer alone.
I am a chemo buddy for life.
We are a buddies network.
No one does cancer alone.
Be a buddy.
And we are all here for you as a community of love.
We are chemo buddies for life.
And if you've heard 3 words, you have cancer, for yourself or someone else, you belong with us at Chemo Buddies for Life.
Healing through connections.
And now we want to give special thanks to Biomed Mobile IV for sponsoring the Health Revolution. Biomed Mobile IV is Colorado's top mobile IV therapy service, servicing throughout the state of Colorado. They offer an array of vitamins and above and beyond safety preparation. Biomed Mobile IV, your dedication to health and wellness is exactly what our show is all about. And we thank you for your support. Welcome back to the Health Revolution. Welcome back, everyone. My guest today, kicking off the new year, Dr. Prarthana Shah, and we've been talking about how she's been successfully combining her medicinal, how she recognizes the medicinal space, but also combining the health coaching to really have that 1-2 combo for those that she works with. Tell us a little bit more about your approach. And I know as we're doing this, I want to talk more about Buova Care and some of the things that you offer, especially in the virtual space.
Yeah, so I offer one-on-one coaching that is in person or virtual, anywhere in the world with the virtual thing now happening, and telemedicine post-COVID, really. So one-on-one is my big thing. I also offer group coaching sessions for people wanting to work with, a group of people, have some people championing you, work together and have that kind of setting, like with CrossFit groups and things like that. So that is one of the other services I offer.
Is there an area of the globe in which you're finding that you're working more and more with, even though you're expanding as the need arises?
So the US definitely, and also a lot of people from London actually I've been coaching now. So these are two spaces I feel like I'm seeing more and more uh, people come to me.
Do you get to travel often to both?
I do about 6 to 8 monthly. I do. I definitely. I love traveling in general, so I'm always finding new places to go to and holidays around that, some work around that, things like that.
So you obviously you're not one to sit still. You're you take the time to connect with those in this space. Do you meet whenever you're in a different area outside of India? Do you try to meet with clients, patients in person? Is that also part of it as
Yeah.
well? Oh, you do?
Yes,
Okay.
yes, yes, I do. It'll be great to see anybody and connect with anybody that I have been working with. And lovely to see their, journey, see how they've been, how they've been growing.
So the future of where this is going? What are you noticing, or what are you hoping some of the aspects of, because this is a great combination of the medicinal approach and then the health coaching. Where do you want to see this go?
I want to see this go big, actually. I want to see a lot more awareness around the healthcare space. I want really, I mean, if I could, I'd want there to be a change at a very grassroots level in the whole medicinal approach. I'd like to see medical colleges, offering coaching. I know that a lot of hospitals abroad now have health coaches in the panel. This isn't yet in India, but I'd like to see that really happen. I'd like to see more and more people approach coaching as a method along with medicine to be working on their concerns and actually creating new habits and new healthy, well, changes to their diet, to exercise, so many different things.
What do you think has to happen in the conversation so that this needle can be moved forward in those settings?
I think there needs to be a more positive talking about coaching. I think there needs to be more awareness. I also think that people need to be, educated on this. I feel like with these one-on-one sessions, when I speak to doctors or in group coaching calls with clients, I feel like they actually understand what coaching is. And a lot more people are actually now embracing this, which I definitely see so many people wanting to explore, which is really great.
The pushback, where is it? Is there any area in which it surprises you where it's coming from? The objections, the roadblocks, that at any, that maybe it's a stalemate, that it's just not happening. Maybe not just in India, but any time that you explore where this can grow.
With India, I feel, at least with India, well, I feel like a big roadblock is doctors, because a lot of people I've spoken to, like I said earlier, they're not very open to it and open to change. I feel like that is one roadblock that I've been facing. I don't find so many roadblocks with the US, actually. That is why I feel that there is a big uptick in people that I am coaching there, because I feel like a lot more people are aware of what health coaching is and are ready to work and commit that time and energy and make those changes in their daily lives.
Would you say that there is a strong correlation with some of the diagnoses that are cardiovascular related and obesity? Would you say that I know that the language has to be careful in connecting the dots. Would you say that there is a big enough correlation between the two, between, say, health choices and then the diagnoses that we hear, or maybe that nobody wants to hear about, that they're being told that they might have?
Yeah, so actually two or three different things. Number one is abdominal girth. That is a huge risk factor. Obesity and abdominal girth is a huge risk factor for cardiovascular heart disease. Again, very modifiable. It is a modifiable risk factor. Lose the weight, that risk goes away. But when you look at obesity as a whole, it is not just obesity. Obesity comes from your exercise, your diet, certain hormonal changes that may be happening. So when you have to look at it with a larger screen and a larger lens, essentially, you have to look at what you're eating. And so an unhealthy diet, again, is a risk factor for heart disease. And eating right, eating the right fats, eating less carbs, eating enough protein, the basic things when you talk about a heart healthy diet, that needs to be approached with care, and you need to look at it more deeply. A lack of physical activity is also leading to obesity, and separately, lack of physical activity or physical inactivity is another risk factor for cardiovascular heart disease. It is not a luxury. Exercise is a necessity, just like breathing, eating, things like that. It is a huge necessity, and we need to be again looking at that. And so it's not just one risk factor. I feel like it is a multitude of risk factors that causes obesity. Again, when you look at your thyroid, that will add to your obesity. So screening then is important. Diabetes would add to it. So I feel like, again, looking at your risk, your parameters regularly helps you keep everything in check.
Well said. We're going to take a quick commercial break. Stay tuned. Don't go anywhere. We will be right back after this.
Greetings, I'm Angel Marie Monticelli, host of Energize You TV, every Thursday at 11 a.m. Pacific Time. Go to Fresh Takes right here on E360 and get Reikified and energized today.
Welcome back to the Health Revolution. We're back on the Health Revolution. My guest today, Dr. Prarthana Shah, cardiovascular specialist, founder of Buova Care. And Dr. Prarthana, where can viewers find you? Talk a little bit about how they can reach you.
So my Instagram handle is at Buova_care, and my personal is at Prarthana24, but it's an open account. So I feel like that is the main place to find me. I'm also at LinkedIn at Dr. Prarthana Shah. I'm also on Facebook. I have a Facebook page called Buova. So that is another place that, anyone can find me.
Talk to us about what you've got going on for 2024. We've started the new year. We've just now rung in the new year. Tell us a little bit about where do you have anything that keeps everyone up to date with what's going on with you?
Yeah, I have my newsletter. It comes out every 15 days. It's mixed with a lot of health insights, stories, inspirational stories, back-end stories of what's happening at Buova, maybe some recipes, just a mix of a lot of healthy stuff. And I call that the inner loop. And there is a link on my website to that, or in my link tree where you can find it and sign up for it. I also have another podcast coming up on the 24th that Simply Fit. So that is another thing that is happening. And I look forward to doing a lot more of these and actually connecting with people one-on-one as well.
Fantastic. I'm going to see if we can bring up the screen where you talk a little bit more about the inner loop and the inner loop. Now, is that the program that you do have that's part of that? That's a sub program that that allows others to get to know what you have to offer?
Yeah, so that is, I share my sort of bi-monthly updates on this. This is my email newsletter that goes out to anybody that signs up for it. I have a separate landing page on my website for this where you could put in your email and sign up. And then you'd receive the first newsletter. And then as it comes out on every, 1st and 15th of every date.
That's fantastic. And well, I'll tell you, Dr. Prarthana, you bring important information, especially as so many people are looking to the new year as the natural turning of the page and naturally looking to our health, and that tends to be one of the more common New Year's resolutions that pop up. What is the one advice that you would give to someone who decides that, listen, it's a new year and it's new me and I'm ready to be better with my health?
I feel like the first thing that they need to do is commit to it. And it's just a 1%. What I do personally is a 1% better every day, because I feel like those tiny changes really add up and create that lasting and remarkable change that you really want to see. So it's just 1% better every day. What is something that I can do just a little bit today towards my health to, make it better and healthier?
Yes, and I wish we had more time. Of course, we are out of time. Thank you so much for joining us today. I appreciate you being here.
Thank you. It was great to be here, and I loved having this conversation. I wish we had more time as well, but I'm glad we did this.
I know, time flies.
Yeah, it
And
does. It definitely does.
yes, and to all our viewers, of course, you know that our website, we are available. You can find us at www.thehealthrevolutiontv.com. That's where you can keep up to date with all of our upcoming shows and information. And if you have ideas about show topics you'd love for us to cover, definitely let us know. Also, if it's a quick reminder, we are scanning our QR code. If you're wanting to have a quick way of getting onto the website, it is there for your partaking, and you can get a quick snapshot of that. Do not forget that on E360 TV, you can find us on Tuesdays and Thursdays. It is 10 a.m. Pacific, 1 p.m. Eastern Standard Time, right here each and every single week. We are ready to continue to come on strong for 2024. And don't forget to subscribe. And until next time, definitely take care. Happy New Year. We will see you soon. Take care.